measurements for elbow flexion as well as extension using the universal goniometer. You want your patient to be positioned inside a supine position with their upper arm inside 0 degrees of flexion and their, again, upper arm close to their trunk and parallel to the body. What you also want is a nice towel to be right under the elbow. This is going to help stabilize the arm and help any sort of elbow or shoulder extension from going on. How you also want it to happen is you want their forearm to be inside a supine position with their palm facing toward the ceiling. To further stabilize during the process, what you're going to want to do is have one arm over the humerus just to stabilize and make sure the shoulder is not going to any sort of flexion during the process. Normal end feels that you're going to feel are going to be firm as well as soft. Firm is going to come from any tension that's going to be building up within the joint capsule. And the soft is just going to be muscle bulk rubbing against itself once it gets to the end feel. So, how you want to position your goni is you want your fulcrum to be lined up with the lateral epicondyle of the elbow, with the proximal arm being lined up with the lateral midline of the humerus using the acromion process as a reference. You want your distal arm to be lined up with the lateral midline of the radius using the radial styloid process as a reference as well. So, once you're here, again, stabilize the arm at this point, get it right at the lateral epicondyle, get it all there, bring it up. Now the normal range they're going to want for the elbow flexion is going to be between 140 and 160. Not 140, 160. 140, 150. This lines right up to 140.